Awesome. All right, Dr. Shehab, thank you so much for joining me all the way from Australia. How you doing today?
Good, thanks, DJ. I'm really looking forward to chatting.
Yeah. Could you tell me a little bit about what you do?
Yeah, so I'm a holistic dentist and I specialize in treating children with orthotropics. So what that means is that being a holistic dentist is we try to look at the whole body rather than just the teeth, and we try to treat the mouth in relation to the body rather than sort of looking at it as an isolated case. For instance, if somebody's got tooth decay, we try really hard to see, well, why did that person get tooth decay in the first place, and try and address those issues as well as the tooth decay. So what I specifically do is orthotropy. So that means with children and many adults, probably about 15% of my patients are adults, around that. And we train them to breathe correctly, to have correct tongue posture, to swallow properly, to have good neck posture, to and how that relates to their entire posture, and that helps with so many things. Like for instance, there's one young lady that I'm treating at the moment, and she's come in because she clenches her teeth when she's asleep, and her main symptom was like her teeth were starting to hurt because they're getting really sore because she would clench so hard when she went to sleep. And then so we address her whole function in terms of how her teeth come together, how she overclenches, and how she sleeps. And we get a lot of improvement. So with children, we basically try and get all those things working properly so that their faces develop really well, and you get really amazing results, which is
So that's interesting. So if you're clenching during sleep and having issues from that, is there like a mouthpiece you give them, or is there actually some? Is that an unnatural thing that is a byproduct of other functions that are kind of misaligned?
yeah. So I think when it comes to clenching when you're asleep, I'm starting to feel that a little bit of it is natural, but
Hmm.
it should be asymptomatic. You shouldn't wake up with a sore jaw, and you shouldn't wake up with like what they call tension headaches, where uh, your skull feels like it's sort of compressing, and you get migraines, and then you shouldn't have those symptoms. But a bit of it might be natural, maybe. I'm not 100% sure on that one. And the difference is, but when you clench your teeth and you get really sore, the difference, like compared to say doing some exercises to work your jaw out, is that it's an unnaturally prolonged amount of clenching with a lot of force. And it's a bit like, say, suppose you've got a weight on your biceps, and instead of instead of doing like repetitions like this, you get it to a certain point where you're holding it like that, and whether there's maximum muscle contraction, and you hold it there for like half an hour. Now, if you do that along for, over and over, the muscle starts to get fatigued. And when you start getting fatigue of the muscle, it doesn't necessarily mean that the muscle's stronger. Often it actually gets weaker because the muscle's being overworked in an unnatural way, and it starts to atrophy a little bit. And it's a bit like some of the neck muscles, where if you've got really bad posture, you can imagine that if your head goes forward just like this, you'll get activation of, say, for instance, your scalenes, which are muscles that run from your C2 right through to about C5 to C7, and they connect to your first and second rib. And if if you and it's supposed to be used for things like this, you know, I don't know what you call that action, but so nodding to the right, to the left and right. But if you've got forward head posture, then what the scalenes do is that they tighten up to try and hold your head right. And then a lot of people with forward head posture, if you push behind that thick muscle on the side there, you'll find that it's really tender. And the tenderness doesn't mean that the muscle's strong, but that particular muscle has been overworked and shortened and atrophies. And in that particular case, you need to be able to try and lengthen the muscle, stretch the muscle by getting good, posture, and maybe even strengthening it. So I know I diverted a little bit there.
Yeah. It sounds like it's just chronically fatigued
Yeah,
in a shortened
yeah,
position. Yeah.
that's
So
right. So that's
it's
how it relates.
interesting
Yeah,
because you don't want people like it's not optimal to be sleeping with your mouth wide open, right? But it's also not optimal to be clenching the entire time you're sleeping. So I guess that medium ground is an issue of posture at the end, which is what you work on.
Yeah, well, it's interesting that you coupled those two postures where you've got the mouth open and the mouth closed, because often they come in together as a couple. And the
Hmm.
reason is that when somebody's a chronic mouth breather, they often have airway issues, and those airway issues come in the form of the tongue, uh, getting falling down the back of the throat. And when you try and breathe through your mouth, it creates turbulence because the tongue is there and you're unable to breathe properly. And in order to breathe properly, you bring your jaw forward and up, just like when you're performing CPR. The old days when we used to do CPR, I used to do mouth to mouth resuscitation. They don't do that. I don't think they do that anymore. But when they bring the jaw up and forward, you're actually opening the airway. So what happens for those people that are mouth breathing? They alternate between mouth breathing and clenching, mouth
Mm.
breathing and clenching, and they clench so that they can breathe, and that helps them breathe. So and if you see it, like sometimes if you ever if you see somebody who does do that, you'll see them, they'll snore for a bit and then they'll go and then clench and grind left and right for about 10 seconds and open up again, and then they'll go into an apneic sort of like situation where they don't breathe at all. So they're kind of, so the moment you address the mouth breathing, which is also connected to the posture and also airway, then you often see a reduction in clenching as well, which is sort of weird. People think, well, how on earth do you clench when you've got your mouth open? But you do this pattern of cyclic clenching and mouth breathing in between, which is absolutely bizarre.
Oh, that's fascinating. Yeah, I'm
Yeah,
I'm gonna have to start looking at people while they're sleeping now and do that. But it
yeah,
makes
yeah.
sense. You go from one extreme to the other, and you're
To
in a
another,
state of
right?
stress, right? Yeah.
Yeah.
Very,
And
very
it's
fascinating.
interesting because you should be able to almost identify a lot of people who may be clenchers or grinders just by their facial posture. Like often you'll find a lot of people that are mouth breathing during the daytime are also mouth breathing when they're asleep, and therefore likely to be clenching or grinding. And so a lot of these people during the daytime will have their mouth slightly open, and you'll see it only needs to be open about that much. It doesn't even need to be open much. And because you often ask people, oh, do you mouth breathe? And they'll say no, but you see that their mouth is slightly open, and they don't realize they're doing it because it's such a chronic habit. So in their situation, they're likely to be clenching and grinding. And then there's those other people that have got their mouth, like the fighter Jake Paul, like I think he's doing a bit of UFC fighting now or boxing. I think he's a chronic mouth breather. You can see his mouth is always open. And so for people like that, if he has not already, because he's got like pretty good fitness, so that kind of counteracts the sleep issues to a certain extent, because he's during the daytime he's building up so much carbon dioxide from training, and then he offsets breathing it all out when he's asleep. So he
Mm.
may not get as much symptoms when he goes to sleep because he's offsetting it with a lot of exercise, which is not the ideal scenario. You want to be able to breathe through your nose during the day and not rely on the exercise to be able to sleep well. So,
Yeah, that interested me because I've seen quite a few boxers who mouth breathe, and
right.
it surprises me because when you are boxing, you don't want your mouth open, and they have a mouthpiece in which they clench on.
Yeah.
Like from my experience playing football, that's kind of how I learned to keep a nasal breathing, was because I had a mouthpiece in and I had to keep it in. So I was
Yeah.
unknowingly training it. So when I see boxers who are heavy mouth breathers, I'm like, that's interesting because in their practice, you're encouraged
Yeah.
to keep it closed.
You are. And I mean, there's so many different breathing techniques, but Floyd Mayweather seems to be a really good nasal breather. And I think that's worked for him quite well because he's, I think, over 40, and every now and then he does an exhibition fight, but he's still able to mix it with the young fellows because his breathing is so optimal. And I mean, credit to him, he also trains all the time. and so he maintains his fitness. But he's a really good example of a great nasal breather during fighting. And you would see also some other like uh, Israel Adesanya as well, or even if you look at other sports, say for instance Cristiano Ronaldo, when it comes to soccer, or who else is it? There's a few tennis players out there that also nasal breathe quite well. Roger Federer, and so they actually maintain their peak fitness by, part of it is from nasal breathing and doing the sport during nasal breathing. So it's hard to do. It's hard when you first start. It's hard to do, but if you're able to do it and develop a tolerance for that elevated carbon dioxide,
Hmm.
it's almost like altitude training. And when you go
Yeah.
into whatever sport you do, you're able to maintain a calmness of the mind and things like that. So yeah, I mean, it's one of those things that if you're a boxer and you've got your mouth open, you're really going to be kicking yourself in the foot, because you're going to run out of energy quicker. And I was speaking to Sam a few months ago, I think September last year, about she does jujitsu, for those who don't know. And so uh, one of the things that I think I look, because I do a bit of jujitsu as well, and one of the things that we look at, especially as you age, is that if your opponent is a mouth breather, we just give them time to breathe it all out. And after they breathe it all out and they've done all their thing, they start getting really tired. And then that's when
Mm.
you've got an opportunity to start, doing things a bit slower. So
Oh, fast. Yeah, that's a good tip.
yeah,
That's a hack right
yeah,
there. Yeah, I like the
yeah, but
analogy of mouth breathing as going into fourth gear, right? It's like you're
yeah,
redlining now if you have nowhere else to
yeah,
go. So the longer and bigger capacity you have until you have to reach that, you're gonna be better off. You're gonna have that advantage.
yeah. I mean, it's just like uh, just releasing all your fuel so much quicker, and it's so it's so valuable to be able to hold, to not breathe as much, because when you do that, and you would probably know, and all the people who do a little bit of buteyko breathing there as well understand the importance of carbon dioxide. It's a very valuable gas, and we undermine it so much. But when you elevate it, then it actually helps release oxygen from your blood into your tissues, and it also calms your mind as well, and it gets you into a more I would say more parasympathetic. But there's a corollary there, because at one point you're in, you're in a sympathetic state because you might be doing a fight, or you might be doing whatever it might be, but it's competitive. It's not life threatening. And so um, what happens if you balance that with your nasal breathing? Then you're somewhere in the middle, and that's a nice place to be, because your mind's sharper and you can make better decisions and you can have more energy for your body, and that's what you need to be able to perform better. And so nasal breathing. And so there are some fighters out there that do the percussion breathing. So they'll breathe in through their nose, and they'll breathe out in pieces. Like for instance, if they're fighters and they might be punching, they'll and so they'll breathe in one big breath in, and then they'll let out two or three breaths as they're releasing something. And that's fine. I mean, that works as well. And it means that you are controlling your breath. And they might be doing the exhale in their mouth, which is fine as well, because they're controlling the rate of exhale. So they're slowing down their breathing anyway. So they might be doing a half in through their nose and out through their mouth. And I think that's good as well. So yeah.
So, Dr. Shihab, we have a lot of people in the fitness industry who they like pick a lens to view the functionality of a person, whether it's like gait, so they'll look at their feet, they'll look at
Yeah.
their spine, diet, like breathing. So I'm guessing in your view, you're tying it all together on how it relates to the mouth, tongue posture, the jaw. So like when you're walking around in public, can you kind of spot people? Do you look at people's face morphology and kind of be like, okay, I kind of see how this person habitually holds themselves or the habits they have with their mouth? Is there a correlation there?
Yeah, 100%. And it's funny that you say that, because there's so many, especially like if I go to community places where there's a lot of people there, and there's people that I know, and I will see, children, and I'm like, oh no, like, my good friends' children, they're probably got inflamed tonsils and adenoids, and they're chronic mouth breathers, and their swallows all over the place, and their tongues down below. And there's only so much that I can say or do before I start to look like I'm a little bit creepy or annoying. So I do notice it a lot, and from all ages, and it's it's something that is not recognizable by most people because they're not looking out for it. So I certainly look at the tongue posture and and breathing. They're the two things that I see most, and that often relates to. So if you've got a low tongue posture, and it's chronic, meaning that you've been doing it for a long time. It doesn't necessarily mean that you're a mouth breather, but it predisposes you to being a mouth breather. But low tongue posture on its own does have other issues with it, and that includes poor facial development and also a alteration in the fascial network of the body. So and you can sometimes see that with the lips closed, you can tell, well, the way the face is developing, they probably don't have their tongue in the correct position. But often what you see is that low tongue posture comes together with mouth breathing. And when you see that, especially with children, you'll see they're dark and sunken under the eyes.
Mhm.
They're the jaw sort of the angle of the jaw is not very pronounced. The chin seems to be going downwards instead of coming down and forwards. They're not as wide in the cheekbones. The cheekbones seem a bit sunken, and their heads a bit forward in their posture. Their shoulders start to slouch forward. Sometimes you even see their feet over pronating with it when the knees coming in,
Mm.
rotations in their hips, and you'll start to see even when they're in their gait, you'll start to see the front of their knuckles as they walk rather than to their sides. And you see all those in combination, and you see that, and it sometimes comes as a snapshot. It's not like I'm looking at all these things separately, and you see, well, okay, there's an issue there, and uh, I certainly can't fix it all on my own, but I try to delve into as much of those areas, but I focus mainly up here.
Mhm.
And that's where it's really important for all practitioners and fitness experts like yourself to work together as a team to try and get these issues nutted out by individual experts. Sometimes you fix up here, but still there's issues down below the hips, knees, and feet, and so it becomes. And sometimes it's getting the body used to a certain type of movement that is neuromuscular in nature. So that posture can sometimes be well, it is neuromuscular because you've got like a map in your mind of how your body should be, and then when you change that, it doesn't happen instantaneously because it's uncomfortable because there's no neuromuscular memory there, and so it takes practice to become that way. And once it becomes that way, then it becomes embedded in memory, and you can do it all the time. So I definitely do notice, a lot of that, and it's getting worse, in my opinion. I think it's
Mhm.
getting worse generationally, and that's something that's it's sad, but it's good because you and I can help these people to whichever way we can, So
Yeah,
yeah,
it's interesting because attempting looking up some research for this jaw course I was doing, a lot of stuff on how um, like the posture downstream will influence the jaw posture, and then
right.
influencing the jaw posture will influence everything downstream. So it's like all connected. And then seeing as they've shown that like just clenching your jaw increases force output a lot, like when you're lifting something heavy. So they, tested all these maneuvers like the Valsalva maneuver where you're like squeezing your core, holding your breath, clenching your fist. And they found that using the mouth and the jaw was the most effective, probably because it's like easy for everyone to do. Like that cortical
Mm.
map you said in your mind, like the jaw and the mouth, everyone connects to that very intuitively. And you don't have to think much. So I think, using that lens of affecting things from that area of the face might be one of the best entryways to kind of manipulate the system, or
Have you noticed?
have it
Have
gain
you noticed
strength.
that? Have you noticed that in your work with clenching the jaw and bodily strength? Is that something that you've observed? I mean, because I watch a lot of your videos, and I'm thinking, wow, is that something that's been seen with some of your clients to improve?
Yeah, for myself personally, it was kind of reverse engineered because looking back, I'm always making these very intense, like facial expressions, either with
Yeah.
mouth wide open, like really big, or clenching really hard. And those happen to correspond with different type of movements, which is really interesting. But it's never something I consciously or intentionally thought about doing. So after like hearing about, this is actually something studied and measured, I did give it to people, and it produced great results, but it was so much easier for them to understand than, okay, I want you to squeeze here, brace your core, and people are like, what is a core? But if you say, clench your teeth, go ahead. Or even better, if you give them like a mouthpiece, something that they could safely clench on and have feedback, or um, this, which I'd like to get
Yeah.
into, which is your myospots, which
Yeah.
is the tongue exercise dots you have, which you could talk about, but something where you immediately get feedback. It's easy to feel, easy to do, and it gets the results. It's very practical. Yeah, the mouth is a gateway that I think hasn't been appreciated enough in terms of just strength and performance.
Yeah, I totally agree. I wonder when you're clenching, what does your tongue do? Is there any correlation between clenching and tongue posture?
So one of the setups we do is a resistance band. So one of those small looped bands. So we bite that deep, like near the molars, and it's usually wrapped in a towel. And then the tongue's underneath. So it gives kind of resistance that we can drive up against while we're biting. Um, Fatigue's pretty quick, but for like a 20 to 30-second bout, it offers a lot of resistance to bite against, especially for the tongue, to drive the tongue up against.
That's so interesting. I mean, there's all these ideas that are coming to my mind about how that might all work because um, there was a study that has shown that tongue elevation increases knee flexion by 30% instantly. So so I suppose think of like when you're working your hamstrings. So if you're on your hamstring machine, according to this study, and I can send this to you later on, the moment you elevate your tongue to the roof of your mouth, your strength increases by 30%. And that to me was mind blowing. And I was, and I think it's related to your fascial system because when your tongue is elevated, you're connected to all the way to your toes through your diaphragm, through your lungs, via the deep front line in your fascial system. And so, if you think about it as uh, removing the tension, because the muscles are wrapped with fascia, and you remove, well, you tighten things up a little bit. Sorry, so you remove the slack. So you remove the slack, and then that allows the muscles to contract more efficiently. It's like it's like grabbing a, a rope that's connected to a small weight, but there's a lot of slack in the rope, and if you pull, the weight won't get pulled. But if you pull the slack out of the rope, then you pull, then you can actually, it's almost like a pole, and you can pull the whole weight across. And I think that's what might happen. And the clenching is interesting because I think it does something similar. I think by clenching, you're actually tightening up all the fascial systems in your neck. And when you do that, then that allows you to contract your muscles better. And I think that might be related to how our bodies were magnificently designed so that you've got suppose you're in the wild and you're trying to hunt something or something like that. Well, you don't want your neck to be all floppy and loose. I mean, imagine getting hit in the side of the head by something unpredictably while you're
Mm.
out there. So you want to, so when you clench here, then all these muscles on uh, underneath here are activated, as well as obviously your, the muscles here and here, and that stabilizes your neck as well, and then that then transfers to an increase in muscle contraction to the rest of your body, and it only makes sense. So and that's why I was so fascinated when I watch your videos, like when you're holding weights in your mouth, and I'm thinking to myself, this is outside of the box. And there's so many other things that I wonder and I'm not sure about. And some of those things might be because in there was a time where we would chew anywhere from 4 to 7 or 8 hours a day, and that chewing was because the food was harder to chew. It was less processed. It might not have been cooked as the way that we cook it today, and because of that, we needed to put more effort into chewing. And when you chew so much, then this whole structure is developed so much more, and we're actually stronger in this area of the body, and that's become like lost. We don't have that anywhere near as much for the majority of people. So by doing your exercises, it might be that you're re-strengthening these muscles around the face, and that may actually improve facial structure as well, because muscles are connected to ligaments and things that are ultimately connected to bone. And when you pull and push on these kind of things, then they develop the bone, and maybe it might even develop the face a bit, because there are products out there that make you chew. Now, in what you're doing, it's a little bit different for chewing, but it's still contracting the muscles at a very high level, much higher than chewing. And so there's a reason, I suppose, that the strongest muscles in the body are here. Like, if you're looking at it per size, the masseters are extremely strong muscles, and there's a reason for it. And it might not just be for crushing stuff. And there's a, and our teeth can take that, assuming that we've taken care of our teeth. You know, so I find that interesting, very
Yeah.
interesting.
Yeah.
Yeah.
Thank you. Uh, that study you talked about, the 30% increase in knee flexion. I've seen so many studies about, well, the two factors were the clenching force, so how hard you clench, and the second factor was the type of occlusion. So if it was
Mm,
a overbite or underbite, the force would go down. But with
yeah.
proper occlusion, man, they're saying that was one of the biggest factors in like hand grip strength and rate of force production. So yeah, I kept seeing this over and over. I'm like, it's in the literature, it's in the science. But when you look at the mainstream kind of dentistry and all that, it it's very like mewing is frowned upon and seen as fringe, and a lot of
Mm.
the myofunctional therapy doesn't seem accepted. Why do you think that is?
I still think that a lot of the sciences and even the medical bodies, that there is that cult-like mentality on being able to follow exactly what you're taught at the academic levels. And I'm not talking about the research, but what's actually delivered in your courses. That needs to be, uh, they're not taught to challenge the status quo. And here's the thing about science, right? Science is never really fixed. I mean, they come up with one thing that cures this, and later on they find out that that's not good anymore, and this needs to be done. And then they'll find out that this particular exercise is ideal for this, but then later on they'll say, no, well, actually it can be improved by that. And it's always in a state of flux. And that's what's great about science, because you're always trying to improve on things. Otherwise we'd just stop. We wouldn't do any more research. And so where the research meets what is being taught, there's usually a delay. It's not often immediate. And so when somebody graduates from whatever course that they do, that they're not really taught to challenge that or to stay up to date with that. And if they are, they forget. And so I think what happens is that it becomes a challenge to what they they know. Like for instance, like take for example, um, why teeth might be crooked. It doesn't occur to many that it might be related to the environment. Some will say it's purely genetic. But as the research comes out and builds and builds and builds, it becomes so overwhelming that you can't deny it anymore. It becomes arrogance if you do. And so I think that there's a disconnect between the research and the practitioners in short. So with things like mewing, um, in itself, it's not a complete method. I mean, it's something, it's great because you can take things into your own hands, you know, and I think it's empowering. So if you get somebody to go, okay, look, breathe through your nose, elevate your tongue, you're going to get results. But sometimes you need a lot more than that. And the reason I think it's become so popularized is because uh, people want answers and they're not getting it from practitioners, you know, maybe people like Mike Mew or whoever, that they're not getting it from practitioners. So then they take it into their own hands and say, look, I'm going to do it myself. And so, yeah, I just think that it's important, you know, that we become to a certain extent our own physician. That doesn't mean that we neglect and ignore doctors. We go there, they're our guys, but sometimes you know if there's something wrong with you. You know, if I mean, if you've got, say, for instance, I don't know, you get frequent headaches, and the doctor says, "Well, here, take some Panadols." Well, you know that that might not be the right answer for you, and you might go on your own journey to try and find another practitioner, or you might go and try and research and find out what are your triggers, or and you start going on a little journey to work out, well, the reason I'm getting these headaches might be because I you know, have too much coffee during the day or whatever it might be, and I get dehydrated and have sugar, and that causes, and then you start figuring it out yourself. So I think it's important that we, to a certain extent, become our own physician by looking inwards to try and work out what symptoms we have, how we can improve them. We're not going to be doctors because you know doctors go and they study and you know they, but it means that we can guide our own treatment to a certain extent, and I think that's important as well. So yeah.
Yeah, I love that because in my industry, I guess what we try to promote is instead of using like orthotics or something as a crutch, you know, we're going to do a
Right.
passive intervention that is probably going to weaken you, but it's going to take away some sort of fix some sort of um, symptom, you know, which leads
Yeah.
to other symptoms. You know, there's these braces they're selling, which is going to fix your posture. They wrap it around your stomach. All these things that it's not active, it's not empowering, like you said. Like you can strengthen yourself, you can do the work. And what I see with your view, the holistic view, is like you can strengthen these tongue positions, these postures, you can nasal breathe, you can actively change your body through strength, which is what I'm all about. So I really
Yeah.
resonate with that point of view instead of saying, oh, okay, let's put this mouthpiece in or put this machine on that's apnea machines for breathing. Um, you could actually change your morphology in your face. Like you said, I've met people, doctor, who they don't want to chew beef jerky because it's too fatiguing, because
Yeah.
we're in this environment where it's just processed food everywhere, soft food. So I really do think it's affecting us more than ever. And the way isn't another easy pill or solution. It's regaining this strength and function.
Using the human body, you know, I think there's so much capabilities in the human body, and I don't know, it'd be great if people just try to see the potential in their body and what it can do. And by being so reliant on whatever it is, like you said, brace, some kind of brace, then I think you are in a way weakening. Now I remember because you know I had a problem with my shoulders, and I wore a brace to pull my shoulders back, and I think I wore it for a month or two, and I realized that what's happening is that because I'm pulling my shoulders back and the muscles aren't doing it, then those muscles are weakening even more. and they're atrophying. So I was actually exacerbating the problem. I wasn't making it better. I mean, aesthetically, it might have looked good, and maybe to a certain extent, it becomes habitually pulled. But the moment I take it off, I start slouching again. And so I realized that the answer can't be in a brace. It must be in the way I hold my body and how I train my body. And I'd need to actually train my shoulders to sit backwards by strengthening the muscles in my shoulders and between my shoulders to pull my shoulders backwards. And even like your delts and all those kind of muscles as well. So there is this, like you said, everything is being outsourced, being made easier, and we're movement creatures. We're supposed to move, and the moment we outsource that, we're only going to suffer even more and more and more. So that's one of the problems I think that's happening out there with people and treatment.
Yeah, we've outsourced quite a bit of movement and strength. That's true.
Yeah,
Another thing
yeah,
you said that I'd like to ask you about is mewing, which is an exercise. You're saying that's not enough. Like, what else should people think of when they talk about this whole complex up here?
yeah. Well, look, um, I think it's really important to try and use the function of the face, neck, and head in the way it was intended to be used. Now, it's very difficult when we've got, like, here I am in front of my laptop and a little bit sort of, hunched over and things like that. But it's very important to try and incorporate movements that are as close as possible to how we should be moving. And especially when our postures are always in a state of like going forward, we may even need those kind of movements even more, because we're trying to actually get our posture correct rather than being correct already. So it would involve, obviously, with moving, there's a couple mewing, there's a couple of things. You've got to keep your lips together, and your tongue needs to be elevated to the roof of your mouth. uh, Nasal breathing is really important, and chewing. And I think that's the basis of viewing. But you can actually uh, do a little bit more than that. Like, take for instance, um, when your tongue elevates the roof of your mouth. Now, if I can actually have a nice elevated tongue posture, but still my neck is not in the correct posture. And in that situation, I probably need to address how my head sits on my shoulders. And in that what I mean by that is that the back of your head, or the occiput, a lot of people have the occiput, which is where you feel that kind of that bony ridge. It's called I think it's called the occipital protuberance, and that where that is almost sitting on your spine. And what that looks like is, if I'm like this, it'll look like that. You see what I mean?
Mhm.
So it sits on your neck, and if it's sitting on your neck like that, then you can actually do that and still have your tongue elevated. It's difficult to do, but you need to address that as well, because that's going to assist your tongue to elevate. Because when you when your head sits on your neck properly, then when your tongue elevates, your airway is nice and open. But when your head's forward and you've got your tongue elevated, it's harder to breathe. So being aware of how your neck should be is really important. That also ties into how your shoulders should sit,
Mm.
and you want to make sure that your shoulders in the correct position. You would know all about that as well. So when the first thing I'd say is make sure that your neck is well balanced and in a good posture, because that's going to really assist all the mewing stuff that they do. When it comes to chewing, what I would suggest is that make sure there is, in whatever you eat, there's enough food that's chewy. So if you're, I mean, let's suppose we're talking about non-vegetarians here, and so there's a little bit of steak. I mean, make sure that it's not. I know people that won't like to hear this, but it's not too tender. Do you know? Because, like, if you've got a really nice piece of backstrap whatever it might be. Sorry to the vegans, but if you've got like something that's really tender, then what will happen is you'll only chew once or twice before you swallow, right? So you want to make sure there's a bit of like if it's and I'm a big fan of eating the fat as well, so long as it's organic and grass fed and all those kind of things, and chew on it and get it so that it's really really soft, and that takes effort. And it means that you'll be sitting down eating longer. Now, if you're a vegetarian, find chewy things, celery or whatever it might be, that has like a chewy texture to it. And so that and that applies to as well. So if you're having some rice, incorporate salads that are harder to chew and crunchier, carrots or whatever it might be. Um, Things like carrots, for example, don't cut them up. Eat the carrot so that you have to bite into it and crunch it and get a lot of chewing power in it. And that's reigniting chewing and eating, and it becomes more pleasurable as well because you'll sit longer, you'll talk more, it's more communal. Make sure the food comes to you. You don't go to the food, and that's really important. So you don't want to hunch over and sort of like you see in some restaurants where people sort of hunch over and they do that. You don't want to do that. You want to stay tall, elongate your neck, and bring the food to you. Why? Because you're taking care of your neck posture and you're not hunching over. You're not reinforcing that bad posture. So they're little things that you can do. And the other thing is like try not to breathe through your mouth while you're eating, and that can be quite common as well. A lot of people scoff their food down their mouths, and I remember I was treating this lady, and she one of the things she's a doctor who's very busy, and she's a surgeon, and so I told her, look, when you eat, you need to sit down. She goes, I don't have the time. And I go, well, if you don't make the time to do these basic things, then it'll catch up with you and you're going to be forced to make the time. And what I mean by that is because when you sit down and you chew, that's giving you time to relax, to go into, when you go and you eat, you're actually switching to it's a parasympathetic nervous state, because that's what eating does. It relaxes you, and you're digesting and rest and digest. And if
At
you're on
least
the
you
run,
should be.
which you should be, right? Now imagine I'm running around and I'm eating at the same time. I shouldn't be doing that. I'd rather you fast. I'd rather you not eat and do. I'd rather you do 2 meals a day rather than 3, and you do it correctly rather than sort of eat on the go because you're hungry, trying to feed like a vessel in your stomach so that you can go again. I'd rather you not do that. And so what that does, it reinforces posture. It balances your nervous system. It strengthens the muscles that should be strengthened, and it brings back the ritual of eating and gratefulness as well, rather than sort of being on the run and sort of eating. So they're little things that you can do. And the other thing is make sure your tongue does a lot of work as well. So when you're chewing, the tongue needs to be sort of moving the food from left to right. Don't try not to move it with your lower lips or upper with your lips. So you want to try and let the tongue do all the work to try and move the food around. So what this all means is that we're moving back to how movement should be when it comes to this structure over here. And I'm not suggesting anything different other than what our ancestors did anyway, only a few hundred years ago, before processing food, and their faces were so much more well developed than what we are today. So mewing is a good start, and I would say, you know, continue doing that, but incorporate all the
Mm.
movements by spending time eating, by respecting food, by using your tongue to move food around, by making sure your head sits correctly and you're not sort of forward over like this. And if you combine all those things there, then I think it'll be more effective long term. So,
Mm. Yeah, thank you for sharing that. We have some people who might be triggered by the term correct posture because they enjoy nuance. But how I would interpret it is from playing around with some of the bite strength stuff. When you bite and you have to do a heavy load, there's a mechanically efficient way to form of doing it, of aligning your body just to produce more force. So it sounds like that efficient way is considered optimal posture. And it's probably a good idea to make a habit of it, right? I mean, we probably were forced to, moving through the environment and having to chew difficult things, as you said. That's why we really never had to think about it. It's because you were forced to be strong and hold these positions throughout the day. And now we're kind of not forced to by the
Yeah,
environment. So we have to kind of remind ourselves and make an exercise and training out of it to restore that lost strength that we had.
yeah.
One question about eating. I don't know if you have any take on this, but I read something about how nowadays we're taught to chew with our mouth closed because of politeness, but when chewing very difficult things like opening it wider uh, and just having more range of the jaw during chewing is beneficial, or maybe something we don't do as much. Do you know, have any information about that?
I don't really, but when you come to think about it, I think our range of motion was a lot more. And I do see a lot of limited mouth opening. And I would suspect that that is related to the fact that people don't open up wide enough and close. It
Mm,
doesn't necessarily mean though that they're mouth breathing when they're doing it. So if they're,
right.
doing that kind of action, and here's the other thing, when you practice, you can actually open quite wide with your lips together. And one of the things that's actually happens is your our lips have gotten shorter.
Mm,
and that's and I see that like some people don't even have a lip seal. So at rest, their lips don't even touch. And for those people in particular, I've actually got to give them exercises to stretch their lips. It takes a few
wow.
months to get their lips to start touching again because they're not touching at rest. So, in a similar way, there are those who have like uh, such good lip um, size and range of stretch that even if they open quite wide, their lips tend to be touching to a certain extent. Yeah. And I think
Mm,
we've lost a lot of that as generations have passed. But maybe chewing used to look like this, and it's hard to tell, but maybe chewing used to look like this. Maybe it used to have um, let's guess a number of maybe 5 or 6 chews, let's call them chews, of really wide chewing. And then once the food starts to mesh down and close, then the lips come down and then they spend another 30 chews with the lips together. Maybe that's what it used to look like. I don't know because it's hard to sort of, you know, unless we can observe current indigenous populations and people that are unaffected, and there are a few pockets out there, unless we can observe how they eat, it's very difficult to say. But I wouldn't be surprised if there was if chewing was broken up into 2 phases where, okay, a big chunk of food goes in, they crush it down, get it smaller and smaller, then continue chewing for another 25 to 30 goes before actually swallowing it when it becomes nice and soft. So that could be as well. But I don't think that people would chew with their mouth open for 5 chews, then swallow, because it doesn't make sense to the size of their masseters and how well developed their faces were that they only chewed a few times. I think they would have chewed for quite a lot more.
mm,
And that also means that I don't think that when they got their mouth open that they're mouth breathing as well. I think they'd still continue nasal breathing, but that they're kind of opening and closing. And that's important as well because what you want to make sure is that you're not mixing a lot of air when you're swallowing the food, because in that, then the air going into your stomach can then cause issues um, of having air pockets and gas and all that. And then you want to make sure the food is all meshed together so when the acid hits it. So I think there's a lot more to chewing that we may not know completely, but I wouldn't be surprised if there was a couple of different phases of opening wide to get that range of motion. And that makes sense because maybe back in the old days they weren't able to cut food up the way that we can, and it was just more efficient to take a big chunk of food, and it was harder to actually break it into pieces than to just put it into your mouth and start chewing on a really large piece of food. So maybe that's what it used to look like. And um, I mean, that's something we could like definitely experiment. But the biggest thing is just try and chew as much as possible. And
Mm.
getting that range of motion is important, because I teach people how to open up wide to stretch their temporalis up here and their masseters. And that's part of like a rehabilitation program for those who because like every muscle needs to be stretched. So we try to stretch these muscles and those muscles, and even the inside pterygoids, by sort of opening and pulling to one side, opening and pulling one side. So you're actually stretching those muscles regularly so that the spasm starts to unwind, and you start to get some freeing of all the, you know, the byproducts that the muscles are from overlapping. And maybe they're doing that while they're eating. And that would be, I mean, that's interesting. Sometimes it's hard to know.
Yeah, I want to send you to the Hadza tribe just to
I'd love
observe
to.
them eat for
Yeah.
hours and weeks. That'd
Where are
be
they?
very
Are they
because
South
yeah,
America or Africa?
Africa, right? I'm not sure which
Africa.
part.
Yeah.
Yeah,
Yeah.
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 But I could see
Because
like
I'm
you get a big turkey leg, and you're opening up your mouth wide, and then you're chewing
right.
after that,
Yeah.
right? So you're
Right.
getting, and like you said, what you do in your practice, you're working the mandible through the full range of motion. Like you're getting it wide, close, different positions.
Yeah.
So I think that's just great to do to any joint in general. Like
Yeah.
you
That's right.
use it.
Yeah. And unfortunately, because of the facial development today, the jaw's not sitting correctly on the base of the skull, because remember you spoke about occlusion and how teeth fit together. So when you've got a narrow maxilla and a mandible that fits in there, then the jaw sometimes has to sit further back, and then the disc that sits on top of the condyle, which is the top of your jaw here, sometimes slips forward. And sometimes it's very uncomfortable for somebody to open wide, because the disc has to slip back. And as it slips back and forward, that can cause some uncomfortness and pain. So it's actually really difficult to try and rehabilitate this. But I think it, I think it definitely needs to be looked at, because the malformation here definitely has like a follow-on effect all the way through to your toes. And one point you did mention is, um, you know, I think we spoke about it briefly, is what, how this can affect your teeth. And a lot of people will shy away from doing things because they're worried about breaking their teeth and things like that. Um, it's important that firstly, I mean, if you've got like severe periodontal disease, where, you know, the teeth are actually loose in their sockets because of gum disease that's untreated, then I don't know if that's going to be a good idea. But I think that the ligament around the teeth, um, I think it strengthens. I would say it's, and that's why, and that's, imagine your Achilles, for example. One of the reasons, or any ligament that tends to break, one of the rehab that people do after they damage the Achilles is actually strengthening the muscle, because that strengthens the ligament. And there's ligament around the teeth. So by biting down on your teeth with force, I think what that does, and I don't know for sure, but I think it strengthens the ligament around the teeth. Now, it's a very difficult thing to say for sure, because I don't know if there's any research to go out there and say, well, the ligament actually gets stronger around the teeth. But what that could mean, and this is something that is all at the moment, it's just my mind thinking out loud, and I don't know if I can prove any of this, but what it could mean is that if you bite down with enough force, then the ligament gets compressed to one side or the other. It only makes sense that the ligaments react by strengthening, and then that means your teeth are going to be stronger because the ligaments are stronger. What could that do to your teeth as well? Maybe by biting really hard, maybe it causes microscopic movement in the teeth that actually helps strengthen the teeth as well by making fluids go in and out of it. But then people might argue, well, it could crack your teeth as well. Well, it could, but I don't think that it's a common thing to crack your teeth, especially in if we were living the way we should be living and our teeth are hardened. We don't see in skulls, we see all 32 teeth, and sometimes one or two teeth might be broken, and it's usually from from trauma or somebody like, an axe being sort of whatever it might be. But you don't often see, I see a lot of cracked teeth today. And I'm thinking, why is there all these teeth cracked? And these people don't even do what you're talking about. So it's very
Hmm.
interesting. And it'd be great to see some research on it.
Oh, well, yeah, I've had many people tell me I'm gonna break my teeth, flatten my
Yeah,
teeth, but I see it as you do because we know all ligamental tissue responds to force and adapts. I mean, muscles do too, and bones. I mean, it's gravity. It's the stress and
yeah,
force of gravity why
right,
we have this strong bones. And once we go into space, we start dumping calcium and getting rid of it because we
right.
no longer need it. So it only makes sense to me that the mouth would work like the rest of the body, and when you put force onto these tissues, they're going to strengthen and adapt to meet the demands put on them. So yeah, it's true. I guess no one's really looked at that specific tissue and measured it, but it's got to
It
fall in
makes
line
sense.
with the
Yeah,
principles of the rest of the body's biology. But that is interesting. I haven't really thought about strengthening the actual teeth.
yeah,
That
right.
Yeah, and I wonder if there's statistics on, are people's teeth more fragile, are cracking
I
now
can
that we
say,
have this soft
yeah,
processed food than compared to the past.
well, I can say for sure that I see a lot of cracked teeth now, and
Hmm.
often, and none of them do those exercises you're talking about, and very minimal do they. I think it's related to maybe prolonged clenching their teeth when they're asleep. That might be because it's the time frame of clenching for so long. That's an unnatural uh, directional force in one plane, rather than when you're doing movements or whatever. It's like sharing the load, and you've got a bit here and a bit there and a bit here, rather than sort of getting like a little pickaxe and sort of chipping at one spot. And so I think that might be related to why we're getting, and also because of all the fillings that people having, because that when you remove tooth decay and you put a filling in there, where you're actually weakening the structure of the tooth as well. Another factor that could be related to is the fact that a lot of mouth breathers tend to dehydrate their teeth because the saliva dries out, and saliva actually is kind of like, think of it as like oil for your car. Without the oil, the engine just dries out, and so your teeth need the saliva, and if it's being dried out, then it doesn't get remineralized, and they're more likely to crack as well. So there are a whole bunch of other factors that can cause breakages and cracks in teeth, and that's why when you're dealing with the general public, I guess you have to be a little bit aware where they are in terms of their teeth strength, and it's hard to gauge. But you can look at things like, are they chronic mouth breathers? Are their masseters and temporalis a little bit sore, because that might mean that they're clenching and grinding when they're asleep? And if do they take care of their teeth generally? Do they chew a lot? All those things, and maybe in your situation, just start them off really slow until they build that strength. And then when they get that strength, and the other thing that, and I noticed that when you get them to bite on something, is it quite even all the way across, or is it certain, or on the molars, or whereabouts do they bite when they're lifting weights with their mouths?
So yeah, so this is taken from like the classic strongman feats of strength, which have been done for
Yeah.
almost a century now, and they've lifted 300, 400 pounds doing this. Um, yeah, so it's back of the molars is where you want the bite, never to feel pressure in the front of the teeth.
Yeah.
So yeah,
Yeah.
they try to get it near the back.
That's amazing, hey, that they can do that. And the other thing is that's really interesting is um, where the bite is. So for example, when they're biting down, if all the teeth on the back are touching evenly, then what's going to happen? It's like saying, when you got a bit of wallpaper, you can tear the paper quite easy if it's not against something. But if the wallpaper is against the wall, it becomes really strong. And what I mean by that is like when, if the teeth are biting evenly all the way and holding together, then they become strong because it's no longer just it's not relying on the ligaments as in as much as it is how the teeth lock into the jaw, lock into the head with all the muscles together. And in that
Mm.
situation, it would make sense that you're getting so much more strength. And I've seen those people that pull trains and things with their teeth. And that would make sense to me because it's one unit where they're using everything to to um to be able to move. And that's where they probably get all the strength from.
Yeah,
So
this is the
technique is
structural
important.
integrity, right? It's same
Right.
with like
Yeah.
grabbing something heavy with your hand. We can grab, you know, 800 pounds. People have done it with this switch grip with their hands. But
Yeah. Wow.
if you don't do it with that right technique, it is not going to happen. It has to
It's
be
not going to
locked
happen,
in,
right? And that requires a full body kind of like awareness and integration.
right? Right,
So
right. The
yeah,
holistic view, right? Everything is connected.
that's
And
right.
interesting enough, when you said uh, about the teeth damage, these strongmen, a lot of them into old age kept doing these feats of strength. And I think the mighty Adam Jr. was 93 years old. He was just on America's Got Talent, pulling a car at 93 with his original teeth. I haven't seen any of them have any teeth damage. And just to be 93 with your full set of original teeth is impressive enough, right? So I would really like to see if we could measure these people. Like, are their teeth stronger or more resilient in some
Yeah.
regards? Yeah,
And
that
the
is a
ligaments
fascinating
around the
question.
teeth,
Right, right.
I reckon they'd be more robust. I mean, I reckon that I think that they'd be stronger than the average person because of just continuous strengthening. And that'd be an awesome thing to do. The other thing that I find um, as we age, one of the muscles that are not strengthened groups is here and your neck, often neglected. I've been unfortunate and fortunate at the same time in that I've had like a neck injury, and I do neck strengthening exercises daily because it's part of my morning routine now. I do my 10 or 15 minutes exercise, and I'll do neck strengthening exercise. And I was thinking to myself, what was I doing before that? I would never include neck exercises. I would never do that. And I think that, and you see it with a lot of people that, you know, the age, sometimes you see 70-year-olds with amazing bodies, but their neck doesn't look quite strong,
Mm,
but the
mm.
rest of the body looks quite good. And I think it's because they've neglected the neck and they don't do basic neck strengthening exercises. Uh, well, and the jaw as well. So that's interesting, a part of the body that's often neglected.
Well, how I got really into a lot of this was from a car accident. I had neck issues and could no longer. I used to have this neck harness where I would do neck extensions and train my neck, and it started giving me issues, and I couldn't really push the weight or do it without discomfort. And when I
Mm.
started dabbling with the jaw training, my neck felt great. And now I do all my neck training with the bite anchor, extension, flexion, all the planes, and it allows me to do it. And my neck feels, I mean, great now. Like I was able to get strength through this alternate way of accessing it than, on the
Mm.
back of the head, like traditionally a lot of people would do. And that's kind of how I wanted to explore it. And then once again, looking at the studies, the jaw and the cervical muscles co-activate together. It's like one system.
Yeah,
They're even saying chewing, like it's chewing is no longer like a facial jaw activity. It's a neck face. I think the word they use is a craniomandibular cervical system, mastication system or something, because they
that's so
see it as
cool.
all one complex you're conditioning when you're doing those things you're talking about. And I mean, the neck, the spine, it's all so important relative to the rest of the body. So yeah, I think like you said, the neck is it's underutilized, and I think that goes hand in hand with the jaw.
So let me get this straight. You had a neck injury and you were trying to strengthen your neck, but your symptoms would get worse up until you started using your jaw. Is that right? Because that's fascinating.
Yeah, I would have discomfort doing neck exercises
Yeah.
until I started doing them by loading through the jaw instead of like
Mm,
wrestler bridges where I'm on the back of my head or harnesses on the back of my head. I started doing the jaw, felt better. Now I could do those things again with little discomfort because I think was just able to strengthen him through this
yeah.
alternate way. So once again, now I'm thinking, wait, this is just seems like a better way, especially with the co-activation and
Oh,
connection
yeah.
between the jaw and the neck.
Yeah.
Maybe I should just stick to this and maybe give this to people with, uh, whiplash neck issues because
Yeah.
it's they're very adverse to movement and sensitive to pain. But with that jaw and bite, it becomes very
Very interesting.
natural and just a better experience. It seems like.
My neck, I think I started to get some atrophy from whiplash, and I couldn't even do two or three in a set of just nodding to the side while I'm laying down. Otherwise, I'd get fatigued for 2 or 3 days. It was that severe. And what I did was I just stopped them all, but then my symptoms would get worse. So I thought, well, you know what? I'll just do one. And I just did that every day for a week while I'm laying down on the side. And then I will do every single muscle. So I'll do that, and then I'll do. So that was like the anterior and middle scalenes. Then I do my suboccipitals, where I just go like this, and I just do one or two, and then I do, your rectus capitis when I go from the sides, and so I learned all the muscles, and I did all of them. And if I did more than one, I'd go into fatigue, and so I did that for a few weeks, and I built up to three, and it took me quite a few months. And the only thing I could now I can get like a resistance band and I can do sets of 10. But when I first started, I couldn't do any. And what I think happens with whiplash, and this you might have noticed the same, is that if it's chronic and if it's been going for a while, then the chances are the muscles have atrophied because you get a little bit of neck instability, then that muscle sort of feeds off to that muscle and and they all just start withering away. And I wonder if you're what you're saying is like a shortcut because instead of isolating a muscle, you're actually supporting it with all these other structures and getting stability there. So when you do move your neck, it's in a much more controlled way and it's less likely to um, overburden a single muscle. And I mean, I'm now that I've heard this, I'm going to start experimenting with doing that. So what do you put in your mouth to hold the weight with? What, like, is it the connection between your mouth and the weights? What do you use?
So my personal favorite to start people off with is a towel that they put in their
Yeah,
mouth. Once again, bite near the molars in the back.
yeah,
Find that good occlusion position, and then a light cable that's pulling kind of 45 degrees down, or band that's pulling
oh
downward,
yeah,
and it's just a good line of resistance.
yeah,
And I'll do that from high to low, going down, up to high. I'll go rotations to the side with that.
yeah.
Um,
And what
yeah,
about
then
if you're trying to pull from back to forward? So suppose I want to do this action. Do I just sort of bite it and then swing it back behind my head, kind of, and then pull that way? Is that what you do?
so that one I'll go from high to low. I'll bite in front, and it'll kind of be covering near the forehead, coming up here,
Yeah.
and I'll drive downward.
Or,
You can
yeah.
also
Right.
do that from the back. It's a little, it kind of
Yeah.
blocks your nose a little bit.
Yeah.
That's a little more extreme, but yeah, either of those, same thing with the bite, just from high to low.
And the towel just gets tied to the resistance band.
Yeah, I'll just loop like one of those hand towels size
Yeah.
around the um, cable and
Yeah.
Bite both sides. Yep.
Wow, that's such a good tip. I'm so looking forward to doing that.
Yeah, let me know what you think about it. It's from what I've heard, probably over 30 to 40 people so far have messaged me and said, this is the first time I've been able to train without neck pain. Some
Wow.
neck symptoms, some TMJ symptoms have gone away. So
Yeah.
can't make any claims. I don't really know much about that, but I think it's cool that people are just able to strength train again using a different, alternative.
And you tend to actually connect weights to the towel. Um, do you transition, to weights eventually from that, or do you get them to stay on the resistance bands, or how long before they transition to putting some weights on, and how much weights do they do?
The people I'm working with who are, everyday general population, just the cable, because you could progressively load the cable machine.
Yeah.
The weights is actually an old school, like Thai fighting, Thai boxing drill.
Really?
They used to have the towel and put weights on it and or a dumbbell and just rep out extensions because they're getting like kicked in the head a lot. So they need that strong neck and strong
Yeah.
jaw. So that's been used a lot in that culture, in that sport.
Yeah.
And I think it kind of looks badass too doing that. So yeah, a lot of people will use some weights wrapped around the towel or a kettlebell, especially if you don't have a machine available.
Yeah.
But I like
Wow.
the band and cable personally for people just because of that straight resistance profile that you get to go up against,
Mm.
especially if there's neck issues.
In the NFL, they used to screen people for concussion by looking at the size of their neck, and if their neck to head ratio was not within a certain range, they as you go into the NFL, you'd have to do a concussion protection program where they actually specifically work on your neck strength to increase the size and strength of your neck. So that was one thing that I noticed, that it's such an important concussion prevention tool, and if you don't have it, you're really at a much higher risk of getting concussions. So it makes sense with the Thai boxers to get their neck right to prevent concussion, which is awesome.
Yeah, that's interesting. I didn't know they
Yeah,
did that in the NFL. It makes
yeah.
sense. I mean, you don't want to get your head knocked off. It's good to have a
No,
good base on that thing.
yeah,
So, doctor, I've been playing around with these Myospots. Uh,
yeah,
this is a cool tool you came up with, and I love them because it's simple and easy to use. Um, could you talk a little bit about how you came up with this and kind of how
yeah.
you
Well,
prescribe it for people?
so what happened is that I work with children, and it's very difficult to get them to learn how to elevate their tongue and keep it elevated. And like I was saying before, it's really important to have a tongue elevated posture, because when you do that, it develops your face so much nicer. It assists in bringing your lips together and start breathing through your nose. It also starts strengthening your tongue so that you start getting some resting core strength of the tongue. And by having resting core strength of the tongue, a couple of things happen. The tongue gets a bit more toned, so it actually gets a little bit smaller, because when your tongue is resting low, it becomes a bit flabby. And as with any muscle, as you tone it, it tends to get smaller as it gets toned, assuming you're not increasing in weight. So if you do really high repetitions, it gets like a Bruce Lee kind of muscles. Do you know what I mean? He's not too big.
Yeah.
So with continuous tongue elevation, a larger tongue tends to tone up and get a little bit smaller, and it fits better up against the roof of your mouth. And so when you got your tongue elevated, not only does that happen, but it does calm people down. So I get a lot of children with ADHD, and the moment they start having tongue elevation and nasal breathing, they calm down and they're not like as fidgety. They don't want to jump all over the place. And you notice that. And I see a lot of parents that come up to me afterwards and say, oh, our son was or daughter was, not doing so well in class because they're so fidgety, etc. And then they start improving and their grades get better and things like that. So getting their tongue resting up to the roof of the mouth actually helps them transition to a parasympathetic nervous state as well. And the reason I think that happens is, and I know it's a bit of a segue, but I think it's because as the tongue elevates, there are nerve endings on your palate that are
Mm,
parasympathetic, but also in the back of your throat. I think it's very closely related to where the vagus nerve is. And as the whole structure moves up, it actually stimulates that nerve and starts calming you down as well. Not only that, the largest number of receptors in your lungs that are parasympathetic are in the lower lobes. So as you breathe through your nose, you actually breathe deeper, and your parasympathetic nervous system gets triggered, and you start to calm down even more. So I wanted to be able to uh, teach children how to elevate their tongue in a way that was unconscious. And with children's radio, you give them a couple of exercises, they do the exercises, they go home, they forget about it, and they come back with their mouth open. And so
yeah.
the idea was to get them to have something to stick in the roof of their mouth. And I spoke to a friend of mine, Ibrahim, and he has a PhD in pharmaceutical sciences. And I said, look, this is what we want to do. And we got together and developed Myospots, something that can actually stick to the roof of your mouth and slowly dissolve with tongue elevation. And it will only dissolve if your tongue elevates. So then it starts to develop an unconscious memory and habit where your tongue remains elevated. So that was the whole idea, to try and make that happen. So and then I realized that this works for everyone. Recently we had, an elderly guy, well, not elderly, he was close to 70 years old, and he was a chronic sleep apnea patient. And he tried the CPAP machine and it wasn't going to work for him. He wasn't going to lose weight because he was like, Chiel, I don't want to lose weight. This is my lifestyle. I'm like, okay, fair enough. Well, can you try it? And he said, he actually approached me and said, I want to try your spots. I said, okay, do this 3 times a day, and tell me how you feel. And he comes back to me and he says, I can sleep in my room now. I don't snore anymore. I don't
Wow.
get tired anymore. All my symptoms, like he was so worried that, I mean, and he's an old school couple where they still sleep in the same room despite him and his wife sleep in the same room despite making so much noise, but that's what they do. And now his wife's saying, look, I can actually go to sleep without hearing him, and he doesn't have to have naps in the middle of the day. And that's just by learning to elevate his tongue, get his lips together. And he never actually knew that your tongue needed to be elevated, or that you needed to breathe through your nose. So it was one of those tools that I thought, well, it's just an extra tool to helping this whole thing work. And that's basically how it happened. And yeah. So
Oh, that's very cool. That could be life changing for people. They're able to actually get real sleep at night. And the thing I like about this is eh, like the whole mewing concept where you're dedicating time to it is a little bit contrived, right? There's no like immediate, why am I doing this? But to give like a task where you have the feedback, you're like, okay, I know what I need to do. It's felt, you don't have to think about it. It bypasses any kind of
yeah,
like of
that's
that
it. Yeah.
thinking process. And then it becomes a game in a sense. So that's what I enjoy about it. Cause yeah, without this, I don't know if I would spend time doing it or I'd forget. It just
Yeah.
decreases the level of willpower and inertia needed to do that
Yeah.
practice. So yeah, I think it's a great idea. I like tools that make things easy, make things
And the
easier.
other thing is, it's made to be an unconscious training habit. So you develop an unconscious memory, and you remember, like right at the start of this podcast, we spoke a little bit about different braces. Well,
Mm,
I, we want to stay away from something that actually puts your tongue up there, you know. So, and I mean, I can't imagine what other tools there are, but the idea is that the muscle is activated and it's doing the work. And if that's what's happening and it becomes unconscious, then eventually after, a couple of months, it'll become memory and you won't even think about it. And that's the whole idea behind it. So that it's an it's an unconscious active exercise. Whereas, if you think about CPAP machine, it does the work for you. And I'm not saying anything bad about CPAP, but it's actually opening your airway to try and breathe for you. And I know that's not, they're two different things we're talking about, but they both solve a similar problem, which is like sleep apnea. And so you're pretty much reliant on that forever. And to me, I don't like that.
Yeah, yeah. One path is empowering you to take control, and the other
That's
one
right.
is, like you said, outsourcing your strength, which once you do that, you become weaker because you no longer need it. So
Yeah,
yeah, I'm glad you're going the path of strength and helping people get stronger.
100%.
How so I've seen the internet is full of these before and after pictures of mewing where there's like dramatic changes in people, like the gonial angle you were talking about before of the jaw, people's facial structure changing. What is the realistic timeline for these changes to start happening?
So you mentioned the gonial angle. The gonial angle can be improved by improving the posture of the back of the tongue. So the tip of the tongue goes behind your front teeth, but the back of your tongue should go up to the back where the hard palate and soft palate kind of meet. And that's sort of like if you get your molars, your first molars, that so if you count 6 teeth back and draw a line across, that's where the back of your tongue should be elevated. Now, if you like, for example, you're using Myospots, and after a couple of weeks, you said, okay, look, I want to try and get, you know, better results. So I want to prove the musculature. You put 2 spots in. You put one at the front for the tip of your tongue, and that's like think of that like the steering wheel, and then the carriage is the back of the tongue, and that should be on your hard palate, maybe even about sort of a centimeter and a half from your front teeth. And when the back of your tongue goes up, you should see under here an immediate change in your gonial angle, not because the bone is changing, but because the soft tissue is changing. And you can actually see your gonial angle a lot more clearer by the back of the tongue going up. So one of the difficult things with tongue posture is getting the back up, and that's usually a challenge. And it's not for everyone, but I do recommend people try it. If you get the back of the tongue up, then you get more strength as well because you're getting more fascial, tension and connection. So with that in mind, you should be able to get some immediate soft tissue changes. And that should happen at the moment your tongue goes up there. In terms of getting facial changes like what you see on all the Instagrams and all the social media, it really depends on how um, compliant you are in sticking to your tongue posture, lips together, nasal breathing, maybe even taping your mouth when you go to bed. And if you do that for a prolonged, I would say you should be able to notice some changes from before and after within 3 to 6 months.
Mm.
I would also say, and it would be subtle, and you would have to take like the same shots on the side, 6 months, 6 months apart, and face shots. But then what will happen is that you'll slowly get more and more change, and it will happen a year, 2 years, 3 years. You'll start to see, and I I would recommend that if you're gonna do the whole mewing thing, to have aesthetics as secondary to health, because you're going to start getting um, health changes very quick. Improvement in your, um, how you feel. Your breathing will improve. Your neck posture will improve. Your sleep will improve. All those things will slowly improve. Your chewing will improve. So those things will happen quicker. Now, I always say that aesthetics and health are very closely related. So those people out there that are doing it purely for aesthetics, well, the way you gauge it is how you feel. And if your health is improving, then your aesthetics will follow. Do you know what I mean? So,
Mm.
but that, in my opinion, that shouldn't be your primary motivator. Uh, and it's okay if people want aesthetics first. That's why people do Botox and all the rest of it. But if your health improves, which it will, then it follows that aesthetics will start. And I've seen it where people start doing it, and you look at them a couple of years later, and their faces they just glow because under their eyes they're not sunken anymore. So their eyes are starting to give off a bit more like a clearer skin, and so you see that because they're not always got their mouths dropped like that. So so I would say 3 to 6 months before initial aesthetic changes, you will get some immediate changes just by getting the back of your tongue up and, breathing through your nose. But I would say a couple of years before you start noticing some, cheekbone changes and things like that, assuming that you do it well and do it all the time. And then it becomes part of your life. And, once it becomes part of your life, then you don't have to worry anymore. And so you're redirecting the way your face functions, and therefore the way the bones sit and things like that. So that's a tough question because a lot of people talk about that online, and they're wondering how long, and it's a very hard question to
Yeah.
sort of
Yeah.
give specific times on. So
Yeah, that was a loaded question. I get the same one. Hey, when am I gonna have a six pack or look like this? And it's like, well, you
yeah,
know, let's just take one step forward at a time, right?
that's right.
But yeah, I do think a lot of anyone who's in their 20s and doing the buying the jazzercise is just trying to look better. And
Right.
hey, if it draws people in and they get secondary health benefits, even better, I
Yeah,
guess.
yeah, yeah, absolutely.
So yeah, doctor, thank you so much for taking the time to chat with me. If people want to check out the Myospots, or I know you got a lot of great information on your website, interviews and everything, resources. Where could they find out more about you?
Yeah, at myospots.com. So that's probably the where the website is. But you can also email if you address to Shehab, Shehab, if you address to Shehab at info@myospots.com, that will usually get reverted to myself. Or on Instagram, you can, like, if people want sort of like quick instant sort of, that's how the world's running. You can also just message me on the Myospots Instagram as well. They're probably the best places. So yeah.
Very cool. Yeah, thanks for taking the time to chat with me.
No,
This was very cool. A very cool talk. I appreciate it.
I've been wanting to do this, DJ. I really appreciate you taking the time because I've been wanting to do this and pick your brain about some of these jaw things because obviously they connect to what I'm doing. So I really appreciate it as well. Thank you.
All right. Have a good night.
You too.